Hello, my name is Ashlyn. I am a student nurse. I will be providing education to you about your upcoming gallbladder surgery. Can you tell me your full name and date of birth? Okay, your full name is John Leonard Smith. You are a 66-year-old male, born on March 23rd, 1955. Do you have any allergies? Okay, you have an allergy to penicillin with a reaction of hives. For your past medical history, you have hypertension, myopia, and osteoarthritis. You had a laparoscopic appendectomy in 2012 that resulted in a prolonged hospital stay because of some nausea and vomiting. You had a mole removed in 2000 and a knee arthroscopy in 1997. You had a colonoscopy in 2018 that showed no abnormalities. Your family history: your mother has diabetes, hypertension, and glaucoma. Your father had hypertension, hyperlipidemia, suffered a stroke, and had complications following a surgery. And your brother and sister both have hypertension. For your medication list that you provided to us, you are taking lisinopril 10 milligrams once a day for hypertension, ibuprofen 800 milligrams 3 times a day as needed, Centrum Mins once a day, and 2 capsules of saw palmetto 180 milligrams every day, and that is a herbal medication. You have no contact precautions in place, and there is no chance that you could be pregnant. You mentioned that you have no religious or cultural concerns or preferences that we need to worry about right now. You came in for abdominal pain, nausea, and vomiting. It says that you have biliary colic and cholelithiasis, which are gallstones, so you'll be having a laparoscopic cholecystectomy under general anesthesia done by Dr. Bruner. Dr. Strauss looked at your recent EKG, said that you had normal sinus rhythm, and your chest x-ray was normal, so he cleared you for surgery. Your most recent blood tests were within normal range. However, your blood glucose was slightly elevated at 147, and your MCHC was elevated at 37. Your CT scan showed a simple cyst on the lower pole of the left kidney, but that has not been changed, and it showed a dilated gallbladder with gallstones. I'm going to ask you to open your mouth as wide as you can so I can look inside and verify the safety of intubation for the general anesthesia. Okay, I see that you do not have any dentures, so we will not have to worry about any complications with that. For your medications prior to surgery, you should stop taking your saw palmetto 2 weeks before your procedure because it can increase your risk for bleeding during the surgery. Stop taking your lisinopril 24 hours before your surgery, as it can cause hypotension when it is used with an anesthetic. And stop taking your ibuprofen and Centrum Mins vitamin supplement 1 week before your surgery. And the surgeon will verify all of this with you as well. Do you have any questions for me as of right now? Okay, so a laparoscopic cholecystectomy procedures, they are often outpatient procedures, but we will have to monitor you and approve you for discharge to make sure it's safe for you to go home. Before your surgery, you should shower, shave, and shampoo with a surgical scrub that we will give you the morning of surgery. When you arrive at the hospital, you will be given wipes to wipe yourself down and to sterilize your skin. It's better to wear loose fitted clothing just to make sure you are more comfortable and to make sure that it does not irritate the incision site. We advise you not to bring any valuable items with you to the hospital. If you do bring some valuable items, they can be put in a bag and given to your family or locked away in a safe area. All jewelry, piercings, and glasses need to be removed the morning of your procedure in the preoperative area. And you should stop eating and drinking by midnight before your surgery. You will need someone to drive you to the hospital, stay here with you during your procedure, and drive you home and stay with you for at least 24 hours after your procedure, just to ensure that you are safe. And During the procedure, your family can stay in the waiting area or the lounge, and they will be notified with an update about every 2 hours. And so after your procedure, it is important for you to know that the nurses will be taking vital signs quite often, just to make sure that there are no complications happening. In order to be discharged, there is certain criteria that we have to look for. So you have to have control of nausea and vomiting. You have to be stable, oriented, alert, able to tolerate fluids, able to void, and your incision site must be clean and dry. There may also be some dietary restrictions put in place because of the specific surgery that you are having. Make sure to tell your surgeon if you are having any drainage or redness around your incision site. So it's important to keep the area clean and dry to reduce the risk of any infection from developing. For pain, you will be given pain meds, but it is important to know that the pain meds will not take away all of your pain, but it will get you to a tolerable level. And I saw that you were concerned about post-op nausea and vomiting, so make sure to tell somebody if you experience that, and we can get some medication ordered to reduce that. You may have a Foley catheter inserted to help your bladder decompress. It's important to note that because of the anesthesia, your bowels will be hypoactive for a short period of time, but they should resume to normal functioning. We encourage you to wear your SCDs or sequential compression devices to help promote blood flow to your legs, and to also use your incentive spirometer to expand your lungs and decrease the risk of pneumonia or a respiratory infection. Activity is recommended after surgery. This can be simple things such as range of motion exercises and anything that is tolerable to you, just to keep your body moving and reduce the risk of any injuries or atrophy from occurring. With that, the nurse will have to be with you on your first attempt at walking because of the instability and weakness that the anesthesia can cause when you are coming off of it. So notify your provider if you experience any bleeding, fever, abdominal pain, swelling, jaundice, coughing, or shortness of breath. And there will be a patient education packet provided for you for any extra reinforcement. Do you have any questions for me right now? Okay, I will be sure to witness your signature on the informed consent after the doctor has gone over it with you. I will let him know if you have any questions or concerns about your procedure. I have made a note in your chart of all the things that we have talked about, including the patient teaching, and I will see you on August 24th at 8 a.m. for your 10 o'clock procedure.